Hello, everyone. Very good evening or good afternoon to all of you. I welcome you to join the session with me on why accreditation matters more in the age of digital health records. But before we get into the details of it, let me introduce myself. I am Dr. Ruhina Khan, and I'm the Business Development Manager for American Accreditation Association. American Accreditation Association is an independent organization based out of the US, and we have our international operations office in London, UK, and we are recognized by ISQA. We're also recognized by the International Society of Telemedicine and E-Health, and we accredit hospitals, healthcare institutes, clinics, and so on, everything under the umbrella of healthcare accreditation. So just a quick rule before we start is that we'll try to make this webinar as interactive as possible, but I request you to please drop in your questions in the chat box and I will make sure that I address to them at the end of the session. So uh, let's begin. Okay. Here are the objectives or the agendas that I will take you through in the entire session today. We will understand how the digital health records change the entire healthcare landscape. We will learn why accreditation safeguards digital risks, and we will also discover some steps to become accreditation ready, whether you're an individual or whether you are associated with a hospital or healthcare organization. I'm sure this session will be very helpful in mitigating those risks that come along with the digital health era. Now let's talk about digital health revolution. Here are quick stats that I want to tell you before I get into the details of EHR. About 95% of hospitals worldwide now use EHR or electronic health records. EHR enables faster decision making. It has better patient tracking and improved outcomes. The digital health data flows in real time, monitoring the population health or managing the patient's data. This is also called as interoperability of data. We will get into the details of that throughout the session. But along with the digital era, there comes risks. Risks such as decrease or increase in system downtime, misconfigurations, cybersecurity threats that affects thousands of patient data instantly. Okay. Uh, let's get into how the EHR works and what is the importance of EHR before we get into the digital health revolution and the accreditation aspects related to that. So for EHRs, they provide improved quality of care and safety. EHRs provide healthcare professionals with complete up-to-date patient information, such as, if they have any allergies, what kind of medication they are on, the patient's medical history in real time. Now, this quick access is crucial, especially in emergencies. Why? EHR systems can also incorporate, clinical decision support, which is commonly known as the CDS tools, that provide alerts for potential drug interactions or missed preventive screenings or significantly reducing medical errors. Coming to the increased efficiency in the workflow, while you have EHR systems incorporated in your health landscape or the hospital systems, is that digital records, streamline the administrative tasks, such as, say, documentation or scheduling or so on. And how this helps the staff members is that you free up a lot of time and you focus on patient care. So instead of running behind, every chart, or the nurses are worried about the documentation work, it really streamlines your entire workflow. They also reduce the need for physical storage of paper, one which was very sustainable and environment friendly. It also minimizes the risk of lost or misplaced paper charts. Okay. If you've worked in a hospital setup and if you know how, especially the ER works, you'd understand how many missed charts, the staff really waste time in finding. So getting an EHR incorporated in your system mitigates all of these errors. Now, coming to enhanced communication and coordination, EHRs facilitates seamless, secure sharing of patient data across different departments or authorization providers, or it leads to the better coordinated and informed care while a patient sees multiple specialists. So, if there is a referral, if there are multiple specialists seeing the patient, or if there are multiple diagnoses, you want second opinions of the specialist, so on and so forth. So all of this communication gets pretty streamlined because of the presence of EHRs. Then, of course, there's better patient engagement. Patients can often access to their own health information, which is, by the way, their right. It's one of the most important patient rights. They can get access to their test results, their educational materials to secure patient portals, empowering them to take more active role in their health management because they are so well versed with what's happening with them, what is their diagnosis, what kind of tests have been conducted. The patient also feels very informed, and there's no confusion of any kind of confidentiality or hindrance of data or whatsoever. Now, coming to the population health and research, how the EHRs can aid in this is that aggregated, de-identified EHR data provides a powerful resource for tracking public health trends, whether it is conducting medical research and identifying areas for quality improvement across the healthcare system. So, having established EHR systems can also aid with the statistics or government analysis and having a basic idea of what kind of diseases are prevalent in that particular population or that particular cohort. So that really helps the healthcare organizations and the government alike. Now, when we speak about getting digitalized healthcare, we also have to keep in mind that these risks, these digital trends come with their own set of risks. Okay, let us get into the risks that were more prevalent in the last years and how accreditation can help you mitigate those particular risks. Okay. Coming to digital health systems, there is data security and privacy breaches. The centralization of vast amount of patient data makes EHR system, prime target for cyber attacks. Maybe it could be for hacking, it could be for ransomware, it could be for literally anything under this umbrella. But a single breach can compromise the records of thousands of patients, leading to identity thefts or loss of public trust. Can you quickly tell me in the chat box, have you heard of such a digital breach in recent times in one of the most leading hospitals in the world? I will wait for it. Now let's come to interoperability changes. Once a different EHR system often uses a non-standardized format, making it difficult for healthcare organization to seamlessly exchange from one particular EHR to the other. That's where interoperability comes in play. But there could be many loopholes while you're exchanging data from one system to another. And the lack of smooth communication can lead to incomplete patient information or fragmented care. Then the system downtime and business continuity. As healthcare becomes reliant on digital systems, I feel a system malfunction or a power outage or a technical failure can really halt the operations, making critical patient data inaccessible and severely disrupt the care of delivery. If you've been in a third world country, you understand how the power outages work here and how, saving a data can be a big deal. And that is why people prefer, getting those paper charts and getting everything stored manually. And there are government rules as to for how long can you store this data. But thankfully, with the digital health trends, we can store the data infinitely, helping, research and patients alike. Now coming to techno stress and burnout. What do you mean by techno stress or burnout? For example, clinical staff or poorly designed cumbersome EHR interfaces can increase administrative burden and documentation time, potentially leading to fatigue. of the staff members, and it can halt again the operations and disrupting delivery and so on. uh, Ignoring the system warnings and professional burnout uh, can be very uh, it could be very difficult to process, and for the hospitals and for the staff members alike. You will have high attrition rates. The staff members would not be happy, and ultimately it will affect the patient care. Okay, and nowadays, not just nowadays, it should have been important since the beginning, but we are giving more importance to patient experience right now. So this is a wholesome experience right from the patient who enters the hospital until the time of discharge. We have to make sure that the data is secure, their health is, they're safe, they do not catch any nosocomial infections, whatnot. So there's a plethora of things that you have to take care of. So EHR makes one less thing to worry about, um, now let's get into what accreditation really means and how we can interrelate accreditation and health records. Okay, accreditation right now, some may perceive that it is a brand image, or something that you should be very you should carry as a trophy or a badge. But accreditation is really more than that. It brings up a lot of accountability. It brings up credibility to the institutes, and also it brings how you could mitigate these risks, and it gives you a proper guideline on how to go about your accreditation journey right from the beginning to the end. Accreditation is the digital health and patient safety in these time and era. Patients have also become very aware of how the healthcare system works, and they want to know whether your hospital is accredited, whether it is recognized or not, whether the quality of care and services is top notch or not. So, to ensure these doubts and these questions don't arise, it's really important to have your healthcare organizations accredited. But let's get into deeper aspects of why accreditation is important. I will take you through it point wise. And if you have any questions, please feel free to drop it in the chat box and I will have them answered for you. Accreditation ensures adherence to standards. Of course, when there's a standard, there's a particular guideline or a blueprint of how your hospital will work from day one until the end of accreditation journey. It really makes sure that you adhere to these quality and patient safety standards. Independent accrediting bodies set rigorous evidence-based standards that cover everything from clinical practices, patient safety, to information management system, governance, technology, and whatnot. For EHRs, this means that the system and the processes around it must be defined. Criteria for security, data integrity, and documentation of quality should be mentioned right from the beginning so that there is no confusion later on in the journey. So accreditation makes this possible. Coming to validation or validates the risk mitigation. Achieving accreditation demonstrates that the healthcare organization has implemented necessary protocols to protect the patient data. Example, robust security protocols or access to controls, and who has these particular access, and how this data can flow from one place to another, one department to another. Uh, Basically, it will establish a business continuity plan to recover quickly from system failures. This is a direct defense against the new digital risks. Now, coming to continuous quality improvement, why would you want to go for accreditation, especially in international accreditation, while you have a local accreditation or locally recognized, government recognized accreditation present in your own region? Why do you want to go for these international standards? Is because there's a homogeneous environment that is maintained, homogeneous standards that are maintained, and you would know how to go about from one standard to another seamlessly. Now, continuous quality improvement accreditation is not just like a one-time event that you're accredited now, you've got the logo, you've got the seal, and that's done. That's not how it works, and I'm so glad it shouldn't be. It is a culture of ongoing self-assessment and improvement. Organizations must continually evaluate their use of EHRs, address staff training gaps, and update workflows to ensure that the technology is being effectively utilized, and it is also safe for the users and for the people who are involved in this entire data sharing process. Accreditation, like I mentioned, also builds trust and credibility, especially amongst the patients who come in for medical, for international patients who travel from one country to another. They should be very sure how the data is flowing from one place to another, one organization to another, whether those EHRs are compliant with each other, whether they are HIPAA or GDPR compliant. Patients also do their research work. So accreditation builds trust and credibility. It serves as an external validation of an organization's commitment to quality and safety, including the reliability of its EHR systems. There's assurance for vitals of the patients, regulators, and other healthcare partners, whoever are involved in this particular setup. While EHRs offer a path to better, safer, and more efficient healthcare, accreditation provides the entire framework and accountability of that, which is necessary to manage the internet complexities, the digital risks, ensuring that the technology is implemented and used in a manner that truly benefits the patient's safety and quality of care. So far, so good. Again, if you have any questions, I'm here to answer them for you. Moving ahead, let us go through certain facts in the which are the risks in the digital health era. Coming to cyber attacks or ransomware, did you know that average breach in the US or average breach cost is about 5 million USD, which lasts up to 280 days plus. How will you sort this breach, or how will you manage with the government protocols, or when such a huge data is compromised and they find a loophole? There would be identity thefts, there would be the government will come running after you in case of all of this. And then of course you will also have to pay, as a healthcare provider or institution, you would also have to pay heavy ransomware to secure your data. Coming to human error, 60% of EHR events were due to misconfiguration of data. Data overloads were due to delays and duplicate records. That's exactly why I emphasize so much on having digital health records, is that it will automatically mitigate the risks of duplication or misplacement of data or charts or whatever. Then the downtime. 1 hour is equal to 45,000 USD. That is of lost productivity. Do you understand how many hours of lost productivity will we encounter if it wasn't for the digital health records or systems? Coming to safeguarding digital health via accreditation, these are just the key takeaway points that I've mentioned also earlier. Cybersecurity is one of the options. Encryptions, access control, audit trainings, all of this have to be in place while you're selecting your accreditation body or accreditation firm. Make sure that you make the right choice and you make the correct decision, not only to protect yourself, but also the data or the quality and patient safety standards of the patients that come into your institution. Now, change of management. The tests updates are safe. Whether if the EHR is getting updated, whether that is safe, whether there are any loopholes that the digital team or the IT team can find out, interoperability of data, conversion from one to another. That's something that you have to be very mindful about. Governance, that is the ownership of digital safety. Then continuity of planning, response plans for outages. What will now, since now if your data is breached, what will be your disaster management strategy? What will be your response to certain outages? You have to have a plan for all of these things. And how will you establish these plans? Is that accreditation gives you a proper framework from A to B to C, and you just follow that and trust your accreditation body. Now let's come to measurable impacts of these EHRs incorporated in our systems. We have 20% fewer discharge delays. When discharge comes in play, you have to keep in mind the insurance companies, what are the kind of turnaround time for approvals, so on and so forth. But with EHRs, because there's so much time reduced in administrative work, 20% fewer discharge delays, which is, I think, a win if you ask any hospital at this point of time. 15% fewer documentation errors, again, a big win. 30% faster recovery from downtime, and 25% higher patient trust scores. Like I mentioned, patient experience is something that any hospital or healthcare organization lives for. These hospitals would not survive if the patients are not trusting them enough. So 25% higher patient trust scores just because of accreditation, I take it any day. Let me give you some cybersecurity attack statistics. In 2024, cyber attacks disrupted billing and patient data. About 190 million records were exposed, billions lost, and hospitals were disrupted. Accredited hospitals recovered 40% faster. Now, imagine if you do not have a framework, you do not have a disaster management in place or accreditation framework in place, or somebody to tell you what to do when these hospitals have been attacked digitally, you wouldn't recover from that. But accredited hospitals luckily provide this kind of framework. They prepare your facility, and the recovery rate is 40% faster. Now, moving on. Before we get into how you will make your hospital ready for accreditation, let me just highlight few important risks that are attached to safety in the digital era. One, we have clinical errors from usability issues. We have fatigue. We have inaccessible records, which I think will be such a big issue if patients are traveling from one place to another, or even one department to another. There are catastrophic consequences to data breach. Healthcare data is considered as the most valuable commodity on the dark web. It contains enough information such as insurance details, medical history. They enable long-term identity theft and medical fraud, and the consequences of this are financial ruins, operational disruption due to ransomware. Uh, if there's a successful ransomware attack can lock hospitals out of their EHRs, forcing them to revert to paper, delay or cancel non-essential surgeries, and fundamentally disrupt critical patient care. Erosion of trust, like I mentioned, it shatters the patient trust and severely damages the reputation of the healthcare organization. How do you think accreditation plays an important role in mitigating these risks? Is that one, data breaches, you can have information security standards for system downtimes or downtimes. Emergency management or business continuity is the strategy that the hospitals apply. For clinical errors, we have EHR designs and usability standards, wherein it compels the organizations to access the EHR impact on the workflow, reduce alert fatigue, trained effectively, and incorporate the best clinical practices. But when coming to regulatory frameworks, I think compliance with the legal standards, both local and international, especially when you have patients flying in from other countries to your organization, it reduces the risk of massive fines and legal penalties. So in a nutshell, accreditation does safeguard your hospitals in ways that you have not probably come across. Now, coming to how will your hospital be accreditation ready, there are certain points that I would like to mention and highlight. One, conduct digital gap analysis. Now, one thing that I really want to highlight here is that at American Accreditation Association, we have come up as a commitment to continuous quality and patient safety. We have come up with a campaign where we are asking hospitals to enroll for a complementary gap analysis or a complementary pre-assessment, which will tell you if your hospital is prepared or is ready for any kind of disasters or accreditation errors or documentation errors. And because we're so committed to quality and patient safety standards, we decided that we will make it absolutely complementary for any organization that wants to get a pre-assessment done with AAA. Coming to how otherwise you will be ready, you have to train your staff on data handling and cybersecurity. You have to establish EHR governance committees, audit data backup and restore quarterly. Stimulate your downtime drills twice a year. As much exposure you give your staff members for this readiness, the more they will be prepared, and the more there will be, awareness and less confusion. Now, also always include your IT vendors in accreditation scope. Once you are contacting any of your IT support or IT companies for EHRs or whatever, make sure that those accreditation standards also comply with these particular vendors that are in scope. Moving to, let me just give you a quick checklist for readiness. How will you check whether your hospital is ready for such a attack in digital times? One, you have to have your updated data governance policy. Your staff must be trained on EHR and safety and privacy. I don't mean to say that you have to train your staff just superficially, but you have to make sure that you really get in there, and all your nurses, your housekeeping staff, your doctors, all of those people, even people who are sitting at the insurance desks or third-party company TPA desks, have to be trained in how to ensure EHR safety and privacy. So you have your basic staff taking file from one department to another. You have to absolutely make sure that there's no breach, even when there's a small travel, departmental travel from one place to another. So absolutely everybody in the hospital, within the facility, has to be trained on safety and privacy. Tested incident response plan. Have to have a plan B in place just in case there's some kind of data breach. How will your hospital respond to that? Regular mock audits to be conducted. This is why accreditation also is important, is because they enable your hospital to be prepared at all times. Let me speak about AAA. Since we believe in quality and patient safety standards and continuous quality improvement, we have our audits conducted every 18 months from the time you get accredited, and there's a renewal cycle at 3 years. So you see the kind of commitment that your hospital and any accreditation body, there has to be that kind of trust, regular mock regular audits to see that there's continuous quality improvement, your CAPAs are in place, your documents are in place, and so on. Vendor contracts should include security clauses. It's absolutely important to have that in mind. Now let's get you to the key takeaways. I will be shortly, taking question answer sessions. But before that, let's put this session in a nutshell, which is the digital health records raise stakes for hospitals. Accreditation provides protection, reliability, and trust. Accredited hospitals see better outcomes, fewer errors, and strong reputation. Accreditation readiness is a competitive advantage that your hospital should have when compared to other facilities that do not have the accreditation in place. Okay, this is my favorite section of the session. Tell me, what is the biggest digital risk that your organization faces in these current times? I will quickly check my chat box and have these questions answered for you. I think that's the kind of questions that I have for now, but here are the details. You can always reach out to us. This is our website and contact info and the email address. We're very active on our social media. We're very active on our emails. So please make sure that if you have any questions or if you're interested to come on board to become a surveyor with us, we will be more than happy to have you. And thank you for this amazing session, and I wish you all the best, and I hope to see you soon in the upcoming webinars that we will host. And once again, thank you for your time, and I will see you very soon.